Greetings, ladies and gentlemen. I'm quite honored to be opening today's session this morning. I'm here to share with you something that will certainly change the way you view Parkinson's disease and collaborative work. I'm here in behalf of Dr. Carlos Jauregui Pasache, neurologist, and Dr. Ivan Perez Pacheco, surgical resident, and I myself, an endocrine surgeon from the Hospital General de San Juan del Río, Querétaro. Querétaro is in Mexico. Querétaro was founded almost 200 years ago and is a territory in the central part of the country. But now, Parkinson's disease is one of the most common neurodegenerative disorders there is, and as population ages, its prevalence is rising to achieve pandemic dimensions. Unfortunately, as many other neurodegenerative disorders, there is no actual cure, and management tends to be symptomatic, making it seem as any other neurodegenerative disorder, a death sentence. What we already know about this topic: glucagon-like peptide 1 and glucose-dependent insulinotropic peptide, GLP-1 and GIP, are enterohormones produced by the L cells located in the distal portion of the small bowel. Both are better known for their glucose-regulating role as incretins. GLP-1 and GIP, as well as glucagon, exhibit neuroprotective effects in preclinical and clinical models of Parkinson's disease. Bile acids also have anti-apoptotic and neuroprotective properties. There are largely unknown gut microbiota brain interactions that may alter neurodegeneration course. Secondly, metabolic surgery is the best treatment for type 2 diabetes in terms of promoting better control and reaching complete remission in obese and non-obese patients. Metabolic surgery changes how nutrients flow within the intestinal tract in order to enhance enterohormonal secretion like GLP-1, peptide YY, oxyntomodulin, and GIP. They also increase serum levels of both primary and secondary bile acids, as well as modify gut microbiota. Among metabolic procedures, the intestinal tract bipartition is a novel, simple, yet powerful and safe procedure that does not cause malabsorption nor malnutrition, for there is no restriction nor exclusion of the intestinal tract. We set out to find out whether intestinal tract bipartition might improve Parkinson's disease natural evolution. 5 patients were recruited from the Parkinson's clinic in the neurology department. All patients were debriefed and accepted the procedures. Patients were at Hoehn-Yahr stage 2.5, which means mild bilateral disease with recovery on pool test. All patients were submitted to intestinal tract bipartition and followed every 3 months by both endocrine surgery and neurology departments at our center. Before surgery, all patients were on levocarbidopa, 250 milligrams 4 times a day. All patients recovered uneventfully, and during the follow-up, there was no malnutrition nor malabsorption. During the initial visit, levocarbidopa was reduced from 1,000 milligrams a day to 250 milligrams a day. At 6 months, there were no disease progression. Furthermore, all patients showed a better performance in the MDS-UPDRS total score, 47.4 versus 40.4, with a p equaling 0.0018. The more profound improvement was in part 3 of the MDS-UPDRS. As Atauta and colleagues showed using exenatide, a GLP-1 receptor analog, changes in MDS-UPDRS were evident as early as the 2-month visit. We also confirmed a better performance in part 3 items and significant improvement in other parts. When comparing our findings to those of Atauta, ours suggest a more profound effect as improvement was accompanied by lower than preoperative levocarbidopa dose, with no additional need for a second-line drug. Differences observed between our patients and those of Atauta would suggest that GIP, bile acids, and microbiota modeling might be playing a role. ITB modifies incretin secretion, bile acid concentration, and model microbiota as opposed to gastric bypass, bile digestive diversion, and sleeve gastrectomy. Ghrelin secretion is preserved as bile tracts out. Ghrelin has shown to reduce activation of the microglia as well as decrease caspase activities and stabilizes nuclear factor kappa beta, thus reducing neuronal loss. GLP-1, on the other hand, promotes cell survival, synaptic plasticity, and reduces endoplasmic reticulum stress, improving the aberrant aggregation of alpha-synuclein. As shown by Atauda, exenatide improves UPDRS Part 3 scores while on treatment, as well as post-exposure, suggesting a more permanent effect may be due to increased neuronal survival. Experimental exposure to dual GLP-1, GIP, analogs improve sensory motor impairment, reduce reduction of tyrosine hydroxylase positive neurons in the substantia nigra, pars compacta, and striatum, and improve synapse numbers compared to control and GLP-1 only analogs. Microbiota might play a decisive role in Parkinson's as well as other neurodegenerative diseases. Altered gut microbiome is associated with Parkinson's. Microbiota may induce low-grade chronic inflammation, increase gut permeability, and produce exogenous alpha-synuclein. Other microorganisms might alter short-chain fatty acid metabolism and produce neuroinflammation. Metabolic surgery shifts microbiota to a healthier state, enhancing production of short-chain fatty acids like propionate and butyrate, which subsequently interact with TGR5 and further enhance GLP-1 actions. These are some of the roots and effects of the microbiota in the brain microbiota interactions. Bile acids, commonly known for their role in digestion, elicit either pro-apoptotic or anti-apoptotic properties, especially two secondary bile acids, tauroursodesoxycholic acid, TUDCA, and ursodesoxycholic acid, UDCA, inhibit apoptosis as well as oxidative stress through downregulation of caspases and enhances MAPK. Experimental animal models have shown that UDCA, UDCA, reduces mRNA from caspase 9, BCL2, BAX, and nuclear factor kappa beta, as increases dopamine striatal content in rats. On the other hand, TUDCA tends to restore tyrosine hydroxylase positive neurons in the rat model for Parkinson's disease. In summary, metabolic surgery provides a multi-approach to neuroprotection and neurogenesis, and it appears to be superior than pharmacologic approach in the adjuvant management of Parkinson's disease. To our knowledge, we are reporting the first attempt to modify a neurodegenerative disease natural history with intestinal surgery. Our findings, although preliminary, prompt for further, more exhaustive research, for this might be